My name is Esther and welcome to MedicScan. MedicScan is a resource platform for all healthcare providers. We introduced earlier a segment about doctors' nutrition, and we want to talk to doctors about their nutrition status. We do understand that they are working a lot, saving lives, working through very tight schedules. And this morning, we are graced to have hosted two nutritionists, one from Japan and one from Kenya. And on to our nutritionists, I'm going to give them a chance to introduce themselves. And I'll start from my father left.
Hello everyone, my name is Lucy Chege. I am a certified nutritionist and also the founder of Nutrition Therapy by Lucy, where we deal with matters nutrition, medical nutrition therapy. And thank you for having me.
Thank you and welcome, Lucy.
Thank you.
And to my near.
Yes. Hello everyone. My name is Madoka Kishino from Japan. I am registered nutrition dietitian in Japan and looking forward to this discussion.
Thank you. Thank you so much, Madoka. Let us get started. And I'm going to start with you, Madoka.
Yeah.
Can you tell us the general status of nutrition in Japan?
Okay. Yeah, of course we have many nutritional programs also in Japan. Yeah, I think the first thing, the nutritional program in Japan is the undernutrition among young women. About 20% of young women are underweight, actually, because young women care about the figure. Yeah.
Sure.
Yeah, that is one problem.
Okay.
And also, second problem is undernutrition among elderly. Yeah, we have a lot of elderly in Japan.
Yes.
And the problem is underweight and frail in elderly. And also we have many problems of NCDs, non-communicable disease, like diabetes and hypertension and hyperlipidemia among adults.
Okay.
Yeah.
Maybe the middle age.
Yeah, middle age.
Okay.
Yeah, that is main problem of nutrition in Japan, I think.
Okay.
Yeah.
All right. Thank you. Maybe just from what I've heard, you've talked about undernutrition among young women. So is it common to find undernutrition among children below the age of 5?
No, and especially children's nutrition is very good, I think, in Japan. Yeah, because of the platform of nutrition support for children is very good in Japan, I think.
Okay.
Yeah.
All right. I guess we'll come back to you later.
Yes,
because there's an aspect that people have that people from Japan they live longer life.
Yes.
That's why you have a lot of elderly people in Japan.
Yeah,
so we'll get back to you. Thank you so much.
Okay.
On to you, Lucy.
I think in Kenya we are making it's a milestone for nutrition sector, but still we are experiencing both under and over nutrition.
Okay.
Because you will find that, like in some regions, the undernutrition in children, I think it's a problem. And also you find that we are battling the obesity, like obesity it's rising like every day. So yeah, battling obesity, the diabetes, hypertension, so the NCDs, I think that's the area that we need to focus on matters nutrition. But we are still, let me say, you're making a milestone. You can't compare the nutrition we had 10 years ago in Kenya and now, because even we find that our health system, they are starting to appreciate the work of nutritionists.
Wow.
Yeah.
Oh, that's awesome.
Yeah.
I like the way people have started getting aware of their health and especially their nutrition status.
Yeah.
Now, to the major thing that we are having this discussion.
I think it depends. But as far as I know, many doctors in Japan care about their nutritional status, their health status. I think. But some doctors don't care about their health or don't have time to care about their health because they are very busy.
Yes. I know if the doctors takes care of their nutrition, which means they are healthier, and which means they increase even their time and their availability to take care of their patients. How about you, Lucy? Have you come across clients who are doctors who are having challenges with their nutrition status here in Kenya?
Yes, definitely. And I think our doctors, we appreciate the work they do, but
Yes.
most of them, they tend to jeopardize their health at the expense of their, like they're taking too much care of their patient, but they forget to take care of themselves.
Yes.
Because you find that a doctor, most of them, they skip meals. Like if you're a doctor and you're watching, when was the last time you had 3 regular meals?
Yeah.
You find that maybe they only have their breakfast, then lunch hour, it's not there. And by the time you're leaving for work, you're extremely tired.
Yes.
The next thing you want is to sleep or take a nap before even you're thinking of maybe going back to work. So I think, personally, I would say their nutrition status is moderately, it's not that bad, it's not that good, but we can do something.
Okay.
Yes.
Yeah.
Okay. Amidst their busy schedule, do you think there's an intervention we can do? Because of course a lot of them will cite having very busy and tight schedules.
Nutrition, lifestyle, it's a deliberate choice. When you want to have, like, to walk a healthy lifestyle, the nutrition journey, you have to make choices. Like number 1, just you can even write it down. Say that don't skip any meal. And if maybe your schedule is not that much flexible, you can carry simple foods. For example, let's say maybe you pack a yogurt and some fruits. I think that's a simple but a nutritious meal.
Yes.
So I think something should be done, and also ensuring that the environment that you're working, maybe it could be a hospital setup, make sure that the food that they're cooking, advocate for healthy foods, because I want to believe the same food that maybe they are serving the patients, most likely they are feeding from the same pot. So for the doctors, ensure the environment, your working place, there is those simple, and you are carrying your simple foods, and at the same time the hospital has a well-balanced meal plan.
Okay. All right. On to you, Madoka. How would you advise a doctor who has a very tight and busy schedule?
Okay. Yeah, the same things happen also in Japan. Many doctors have a tight schedule. The intervention for doctors' health is prepare or deliver the healthy meal and healthy meal or healthy snack for doctors as a dietitian in the hospital. Yeah, I think this is one of option or intervention that we can do.
Okay.
Yeah.
Okay. Thank you so much for the comments. I have another question.
Yeah.
So in nutrition, we say there's a percentage that is covered by food, and there's a percentage that is covered by exercises. To you, Madoka, do you think there's some of the activities or some of the exercises that our doctors can try to engage in?
Small exercise between the work, like squat. Yeah,
okay.
it's a very high burden, high
Yes.
physical activity, but it's very short time exercise that we can do.
Yes.
So, yeah, I think it's one of option between working hours.
Okay.
Yeah.
Okay. I think that's a good idea.
Yeah.
That's a good idea. So maybe when they're trying to, maybe when the patient, like for example, in the theater case, maybe when a patient is being prepared, they can be squatting, doing some small exercises. You do not have an excuse for not trying to live healthy or for not even trying to exercise. I have a question for you, Lucy. So for most doctors, maybe their work schedule is from Monday to Friday, or maybe they have offs. So what kind of exercises would you request or would you ask your patients or your clients, doctors, to engage in when they are free?
I think for doctors, maybe it can be hard to work out while you are still working, but you can decide maybe after working. You can decide to go home. You can decide to walk instead of maybe. Then let me say for those who are not driving, you can decide instead of maybe boarding a matatu, you can decide to walk home. And we are lucky nowadays. We have the internet; it's all over. There are YouTube videos. You can decide even after you are extremely tired, just take 25 minutes, do some simple aerobics, and they'll do just wonderful to your body. So you can just decide to walk home, you can decide to walk instead of boarding a matatu, and also sacrifice some 25 minutes or even less than 25 minutes and do those simple workouts. You can jog, you can do the squats. There are simple aerobic exercises that you can access in our internet.
Okay.
Yeah.
Okay.
Yeah, YouTube is good resource. Yeah. I think.
Yes. Yeah. You are saying something?
Yes, YouTube is good resource of exercise. Yeah, there are many movies for yoga, like yoga, aerobic, and workout. Yeah. Yeah.
Okay.
I use.
All right. I think that's a good one.
Yeah.
Maybe lastly but not least, to you, Madoka,
Yes.
for a doctor who is healthy, can you give us like a daily plan for a meal that they can try on?
I think we can deliver like lunchbox with healthy snacks for his break time. We can deliver a healthy lunchbox for doctors, especially busy doctors, so that they can eat quickly and instantly after their work.
Yes.
And even if the short break. Yeah, I think that is one of option.
Okay.
Yeah, like lunchbox delivery service from dietitian.
Yes. How about you, Lucy? If you were to create a meal plan for this doctor, how would you put it?
I think I get such clients. Actually, they say, Lucy, I'm very busy. I don't have time to cook. So I need a meal plan which is, let me say, accessible. And I can give an example of a very simple but well-balanced meal plan. For example, let's say the boiled arrowroots. Those are things that you can boil. They'll take only maybe 30 minutes. 30 minutes, maybe you're taking a bath. Maybe you're watching maybe your favorite series. And by the time 30 minutes are over, your arrowroots are done. So you can decide to have the boiled arrowroots. You can have a glass of milk, and also you can decide to have steamed veggies. So I think that's a complete meal for someone who doesn't have time to start frying, I don't know, the mukimo, all those pilau. I think that's a simple plan that can work for anybody who has a busy schedule.
I've heard that in Japan, nutrition is taught right from a young age, like even from school. Like for example, there's a program in Japan that nutritionists liaise with the government, and they deliver nutritious, healthy foods to children from kindergarten to high school to junior high school. So how has that system worked for you, and how has it helped to curb the nutrition challenges in Japan?
Okay, I think it's a school meal program in Japan. Yes, the school meal program in Japan is very good system for maintain health status of children. And you know, about 100% of elementary school has school meal, and one of the strengths of in Japan is we have many dietitian and nutritionists compared to other countries. So nutritionist and dietitian works at kindergarten and also elementary school and junior high school, and of course at the hospital and like health service center. I think that contribute to maintain health status
Yes.
for Japanese people.
Okay. All right.
Yeah.
I remember you had mentioned about we have a lot of elderly people in Japan.
Yes.
So tell us, what is the secret?
Secret.
Yes, to a lot of Japanese, a lot of elderly people, and even you may find that a larger number of them are even healthy. What is the secret? Maybe we can borrow that in Kenya.
Yeah.
One things maybe Japanese diet. No, Japanese diets are based on rice, and we have many fish because Japan is island. Yeah, of course, westernization is there.
Yes.
And second things I think is health system. Yeah, as I mentioned, that we have many medical professionals compared to the population. Insurance system. Yeah, we can receive many medical treatment at low cost. So almost every Japanese can receive high quality of medical treatment from professionals.
Okay.
Yeah, I think that is cause of Japanese.
Longer life.
Yeah, long.
That's a good one.
Yeah.
To the last question, Lucy, what do you think we can borrow from Japan?
Yeah, I think it can, appreciating the nutrition field and also incorporating the nutritionists in our education system, like maybe ensuring in each county, maybe we have like 3, let me say we have a number that takes care of certain schools. I think that's one way of promoting nutrition and also teaching the basics. Let when a child is growing, they know the basics of nutrition. What is my nutrition status, my nutritional status? And also, like she had said, they have school feeding programs. Yes, I think still here in Kenya we have, but I can't say that we serve most of those nutritious food. I think we are feeding our children food just to keep them in school, just to keep the learning progress.
Okay.
So I think that's something that maybe we should improve on. Even if we are feeding our children, the school feeding programs, let us offer food that are nutritious and also foods that will take care of their health. We try to diversify. It's not every meal, it's githeri. I don't know, we can try to diversify. And also, let's have nutritionists in our schools.
Yes,
Yeah.
That's exactly.
Let's not maybe take a science teacher, it's the one who is teaching nutrition. Yes, she can or they can, but let the information come from a nutritionist.
Okay.
Yeah.
All right. Thank you. Thank you so much for your time, Lucy. Thank you so much for your time, Madoka. We are happy and we are glad that you came. Thank you so much, our viewer, and we hope to see you in the next segment. Thank you.